The atmosphere at the corona ward of Zendal Hospital in Madrid seems almost relaxed right now. Many beds are empty at the moment. For internist Clara Hernández Blanco, the days have again become a bit more bearable. She and her colleagues lived through the worst of the pandemic. It has left them deeply traumatized. I fell into a big hole. I cried in the corner. I couldn't take hearing anything more about COVID victims because in the end they were also my victims in a way. Then last February and March, 400 people would die every day. That was devastating. Many were already desensitized at that point. But of each of these 400, I can give you at least 2 or 3 names and the names of their children. For me, these are not numbers. It also weighed on her that for months she could not see her daughters to avoid possible infections. Hernández Blanco is now in therapy. It helped me to understand that no one outside our field can really understand what we have lived through in here. It wasn't told, and we also don't want to talk about it. Many colleagues in the hospitals in Madrid share that opinion. The experience was too traumatic. First studies show that at least 40% of medical professionals need a psychological assessment. And some experts even think that there's already another pandemic that will soon spread worldwide, the one that affects mental health. In Cesio Arango's hospital, 500 out of 8,500 professionals require extra help. For instance, in the psychiatric ward, which has set up special support groups. We already put preventive groups in motion before it all escalated. These are groups where people can talk about their experience. So you have doctors, nurses, helpers, and one of our psychologists who share what they are worried about. Between the frustration of not knowing how to use their expertise like under normal conditions and not knowing what you deal with, a huge scar has developed, and it's putting a strain on medics. For Laura Sanz, this strain forced her to leave her job. The intensive care medic contracted COVID-19 and then went back to work in the ICU despite suffering from long COVID. We're not superheroes. When you work in the intensive care unit, you're used to 24, 48 or 72-hour shifts almost without a break. Without help, you are strong, you can do that. And all of a sudden you can't anymore. Then it's time to look for help. I went to work crying. Then, at work, I saw how the nurses would cry in the kitchen or where the patients were. The situation was desperate. I found them like this, I cried with them, and then I cried on my way back home in the car. At some point I said to myself, it cannot go on like this. It's a decision she doesn't regret. Many of the affected medics are now processing what they have witnessed. They hope the long queues at Spain's vaccination centers will keep the beds at the ICU free, so they will really have time to heal.